Good evening. I'm Jerry DiPiano. I'm the Chief Executive Officer of Fem Pharma Consumer Healthcare, a company dedicated to women's health. This evening, I'm joined by our medical director, Dr. Deborah Saltman, along with one of our advisory board members, Ms. Theresa Feola, who is an expert in physical therapy, a physical therapist, and has specific credentials in pelvic rehabilitation therapy. Welcome to everyone. We hope that you are healthy, well, and sane during these unprecedented times. And I hate that cliche, but it's the only phrase that comes to mind. So hopefully you'll have fun this evening learning about pelvic PT and ways in which you can address your pelvic health. And with that, I'll turn the program over to Dr. Saltman, Deb, and to Theresa.
Thanks, and thanks very much, everyone, for joining us. We hope it's going to be as informative in your homes as it is in ours. We're all at home, not luxuriating, but working like lots of us do at home. And thanks for taking the time out of your busy days to hear a bit about what we call the vulvo-vaginal continuum and how we deal with it. I'm a family physician. I practice in Philadelphia. I've worked in the UK and in Australia, and I still have my wonderful Australian accent, so I hope it entertains you as well as enjoys you. I've had a long history of interest in the vulvo-vaginal region and also in women's health, so hopefully we can contribute, myself and Theresa, to informing you and leave some time for some of your questions. And perhaps over to you, Theresa. You want to introduce yourself and then we can get on with the show.
Great. Thank you very much for having me and allowing me to do what I love best, and that is trying to educate women and help them improve their health and their happiness. I think people are very surprised to hear that a physical therapist is talking about the pelvic region, and most people do not realize that there is a subspecialty within physical therapy. My board certification is in women's health, and then I also have a pelvic rehab practitioner certification. So you're specializing in a very important, interesting, complex area. So it is a very wide-ranging specialty. I'll whip off just a few examples because I really feel that people probably have no idea what we specialize in. So think anything in the pelvis. It can range from a urinary leakage when I jump to constipation, fecal incontinence, a prolapse, a heaviness of the perineum, cancer, radiation, and reconstructive surgeries. It can be young athletes with biking irritations. It could be running pain in the hip, the back. It can be prenatal, postpartum, and just trying to get the health restored in that area of the body is what we do.
It's a really, really nice summary of what you do. And I thought perhaps we could also talk about the normal vulva and the normal vagina, because, you know, that vulva changes out throughout our lives. I'm sure a lot of our listeners and viewers can tell that it gets thinner and more sensitive even without any insults, and that's making the skin sometimes colour changes, and as it withdraws, because it gets further away, it gets shrinking in, the clitoris gets bigger, so the more sensitive areas get exposed, and it gets drier and it needs being looked after. And so we're going to talk also about the continuum of care, and I think probably, you know, most women first start thinking about it when they have their first child. And perhaps, Theresa, you can tell us some of the things that you've noticed go wrong with the vulva and the vagina in those times.
Mm-hmm. Certainly. And as true with anything that we do in physical therapy, the sooner we catch things, the easier and better off we are. The body is so interconnected that something left untreated or dysfunctional tends to just run wild a bit and expand to numerous symptoms. So the vulva, if there's any irritation in that super sensitive, complex tissue, that tissue embryologically in men is inside the urethra, very protected and not open to environment and all the insults that we do. But for females, that is a very unique and special type of tissue. And we tend to ignore it and really don't understand it at all. And we tend to, as females, pay attention and obsess over every other part of our bodies. And really, what I find is women do not understand our anatomy, do not understand the functioning and how important that area can be. It will become heightened sensitivity very often, and the nerves to that area will become heightened even after a urinary tract infection, a yeast infection, any kind of insult. The nerves are really trying to protect us. So they become very sensitive, almost as if saying, well, I'm not going to let that happen to you again. So therefore, I will pick up any little thing that happens in that area. Unfortunately, that can lead to difficulty tolerating underwear, pants, sitting, bicycle seats, intercourse, wiping, anything like that. That irritation then leads to a secondary problem of the pelvic floor muscles going into spasm. As anywhere in the body, muscles will spasm to try to protect us, more so even in the pelvic floor muscles, because they're really tied into our emotions, our autonomic nervous system, our protection.
Yeah, it's really interesting. My mum taught me all about sex. And when she taught me about sex, she didn't tell me that my vulva and vagina were good for a lot of other things and that I'd have them inside my underpants the rest of my life. And, I moisturise my face. And no one ever said to me, hey, don't stop at the hairline. Keep on going to keep it going and keep it good. And it was only when I started thinking, I brush my teeth every day. I'm pretty good twice a day because I want to keep them. And I was just thinking, what do I do so I don't get to that place, Theresa, that you said, that place where, it's too late if I can't wear underpants. It's too late when I'm always kind of trying to hold down there or having to wear a pad or feeling just even the start of increased sensitivity or itch or soreness. When I am in the shower and I come out and I stop moisturising there and I just think, oh, after sex, I think what's happening, I'm feeling, not from sex or I'm just feeling rubbed. All those kind of sensitivities that come up. And no one talks about the use continuously of a moisturiser. It's almost like at the hairline, stop, that's only for babies and sex, don't do anything else. So can you tell me how you can get women to think about their bodies as one whole integument? It's like the pelvis and the vagina and the vulva and the perineum, all those areas have got P words and V words, how they all form together to, how can we keep them healthy and alive?
Yes. Yeah, exactly. I think first of all, we start by not doing the negative things. As you said, we were never educated in how to care for that body. And I think a lot of times we are really concerned with odors, and therefore we start with the over cleaning process. And as everywhere else in the body, the products. And what is very damaging to that area, because it has its own biome, it has its own way of good and bad bacteria balanced, and it will do its own self-cleaning if we stay out of its way. But really, I think women are so concerned with that. So then we get in habits of using products that have dyes and chemicals and fragrances and warming things, and we are in there scrubbing and cleaning and even douching and things that really are disruptive to those tissues. I have patients who are in the habit of drying with a hair dryer, and those tissues are just different than the rest of our tissues. So we need to be a little more cautious with them. So first, stop with all that extra cleaning and harsh chemicals. And then just like anywhere else, we get out of the shower and we put some moisturizer on face, legs. Now, in this part of the body, it's very important that we have the proper, more natural products as femme pharmas.
With your body. And the other thing is, I find people don't want to talk about stickiness and drippiness. It's like almost, I'm used to it from my periods. Don't talk to me about it. I'm always wet down there. I don't like it. And what kind of advice can we give people about, as you said, really good advice about just normal cleaning is all you need. nothing special. It's not a dirty area. It's a very clean area. And the cells, do turn over 18 or so times in a week. So they're pretty good cells down there.
Yes.
So what else do you think people need to know about how to look after that area?
I think in general, we have to start from the beginning and have women look, touch, and decrease that stigma of ignoring a part. We wouldn't ignore any other part of our body, and we would know right away that that probably isn't the healthy route. So I think we have to eliminate that stigma. One, we have to talk about it more with each other. All of my patients, really the majority, come from word of mouth, women helping women, understanding this and talking about this. So I think, that's the first step, so that we understand the anatomy, we're comfortable looking and touching. It's important also for us to start screening ourselves for anything that looks unusual that could be a bigger concern. So if we start with that, then I think it's a little easier for us to start to say, okay, so this is easy to put some moisturizer on that area of the body and become more comfortable there, so that I don't develop that cycle of nerves being super sensitive, of itch, of burn, of muscles going into spasm. And then from there, we need to let women know, well, how does that part of the body function? How does the pelvic floor function? It works with contraction when I'm being athletic and I need to tighten, and then it needs to work with stretching and relaxation for intercourse, bowel movements, urination. So those tissues need to have the mobility and flexibility, like any other tissues in our body. If they don't, I'm going to start with one aspect of those discomfort and dysfunctions, as we spoke of.
I think a lot of women today have, I come from an era when we used to use a mirror to have a look down there. That was part of what we had to do as we grew up, so we had to know what was happening. Do you think a lot of women have kind of vulvovaginal phobia now? Like they don't want to touch it or feel it. It's not their area.
Yes. Yes, definitely. Definitely. So, some products, as you have, the bud has an applicator. So maybe that's a little easier for women to use an applicator versus the gel on the finger and using the finger. So there's options there, to help with that health.
That's really important. And now, I don't know much about pelvic floor rehabilitation. Tell us a bit about what you do and what it does and how it helps women.
Mm-hmm. So it's very holistic. I think we have to understand the pelvis is almost Grand Central Station. So much is going on there between our organs, our muscles, our hips, our back attach. So we have to look at the whole person. So it could be as simple as me talking with you externally about your back and your hips and how that's connected to the muscles. But then very often there are deeper problems. So maybe somebody has been treated for back pain for a very long time, and nobody looked internally. So we have all these muscles internal that function like any other muscle. They can be weak, they can have trigger points and spasms and pain and not functioning. So we sit down first and we talk and we discuss all the goals, what is happening. If it's appropriate and agreeable, then certainly a big part of what we do is internal, depending on vaginal or rectal areas, what we're working on, what we're concerned with. So we really have a ongoing conversation of the woman's comfort level. So if we start already just examining the external genitalia and vulva, and there is pain or discomfort, that's where we start. So without a healthy external, we can't delve further into the pelvic floor muscles and see what's happening in those muscles. We need to start with that healthy vulva and skin integrity first, and then move on. No muscle will learn how to work if it's painful and restricted.
It really interesting you say that, because when I mentioned it to women and I said we're going to do this webinar on pelvic floor, they say, oh, well, I do the Kegel. I do the Kegel. That's all I need. I did the Kegel. And, you know, I say, well, are you still dry? Have a look at your skin. Pinch it. Are you still dry? Are you still sore? And they don't know what to say. And so part of it for me is helping women understand what's new. It's beyond just trying to do 10 what I call pull-ups as opposed to push-ups an hour, 10 pull-ups an hour. There's more things that are important. And perhaps tell us a bit about them. You know, in an average course, as you said, you've got to start on the outside, you've got to moisturize. And sometimes one of the things I tell women to do in this era of where there's a lot of hand washing is wash your hands all day. Don't put any moisturizer on. Have a look at the back of your hands and see how dry your skin is. And if you look at how dry your skin is, and then it's going to be just as dry down there, because I come from Australia, everything's down there from Australia. So down below, down there, the perineum, vulva, vagina, down there, it's going to be just as dry. So going from the outside, not just doing this kind of contracting up. I mean, there's lots of things that you can do, aren't there, that you can do to kind of help that area.
Yep, exactly. I'm so glad you brought up the word Kegels, because that is the one and only thing that the average woman knows about the pelvic region. And everyone is doing Kegels. And 9 times out of 10, and the research supports, we are doing things incorrectly as far as even trying to do Kegels. And without someone showing and telling us, we really do not do it justice. So it is not good enough to learn on the internet or to have somebody hand you a piece of paper. These muscles are practically invisible. And unless somebody is really directing you, no, you're only closing, you're not lifting, you're not able to hold, you're not coordinating. It's like any other muscle. There's numerous things that can go wrong. And I think first and foremost, what can really go wrong is if you have somebody who has a tight pelvic floor and then they're instructed or they feel that the thing to do is Kegels. So now we are making a tight area even tighter. So the very first thing we do is explain to people and teach them via tactile touching and giving them feedback. And you hear the term biofeedback. Biofeedback can be little electrodes on the external perineum showing you what you're doing with your muscles. It could be internal, inserted sensors telling you. It can be a finger giving you feedback. But the very first thing we do is we start to explain to people that my diaphragm and my breathing and my pelvic floor work together as a piston. So when I inhale, my pelvic floor should expand and relax and stretch. When I exhale, it should come in and contract. So I'm always getting this beautiful in and out circulation, tissues moving activity going on all day long, but we don't feel it. It's so low level. These are little posture muscles. But that's what we need to really be able to instruct and teach women. So very often, one example would be, we're used to people saying, I'm leaking. Well, then we could have a tight pelvic floor not working, or we could have a weak pelvic floor not working. Painful intercourse. It could be painful at the entry. It could be painful deeper in that vaginal canal. We really need to evaluate, where is the system breaking down? As we've been talking, you know, the very first thing is, are the tissues not painful? And nothing can be fixed under a painful situation. So we can work with prolapse. Very often that is a big support issue where any of our organs can be pushing through and creating pressure into the vaginal area, into the rectal area. So now you can picture, if those tissues aren't sound and healthy, I have tissue pushing into the vagina and there's friction and rub where normally there is not. So we have that. We see young women who cannot tolerate tampon insertion. Once we've had one bad experience, if I try to put a tampon in and it doesn't go well and I'm a little nervous and a little scared, the body remembers that. And the next time it's going to clamp down, close, and then I'm in this vicious cycle. The same is true for intercourse, whether it be an abuse situation or maybe I was just dry and I had one bad experience, but now the body is going to try to protect me and lock down. So there's again where we say, if we understand and we get on it right away, teaching women throughout the lifespan to understand some of these signs and symptoms. I think what's so disturbing to me is to hear women who have gone through years and years of discomfort and pain and problems, and it has grown into an even larger issue, and it's such an easy fix. The hardest step, I think, for people is exactly what we're doing. Step one, just start to talk about it. Know that there's help out there. And unfortunately, a lot of times it's not being initiated through our medical community as much, the prevention, the education. So we really have to help to get the word out that there's so much we can do.
It's really interesting that you said that. When you were talking, I think, golly, this is the yoga lattes of the perineum, like breathing exercises, the turning the muscles. It's really kind of the whole kind of yoga lattes activity. I mean, I'm not as aware of that, and I must admit, as a clinician, I don't often talk about yoga lattes of the perineum, but I'm going to start. But I do talk about a couple of other things that you mentioned that are really interesting. What about tampons? One of the things that I find with young girls when they insert them, we know that 50% of women have a retroverted uterus. So it's in the opposite direction. So when they put the tampon in, it hurts. And we found that a lot of people say the same when they use an applicator. It hurts to put it in because the direction mightn't be right. And so that's also a really important point, to just kind of like the direction being right. The other thing is this leakage stuff is pretty tricky. I feel sorry for people who are using products that wet their pants and underpants and that sort of stuff. Really, we need to be using products that stick on, meant to stick and meant to stay and last the day. That's how I kind of see it. I mean, that's one of the reasons why we started tampons in the beginning, is because they weren't seen and they didn't create a problem between our legs. So, I mean, there's a whole issue there. So that's another thing that I kind of share with people. One of my other favourites, of course, is the toilet paper trick. Check the toilet paper out. If you've got little bits of balls of toilet paper, it's either too soft or too hard. Both of them can kind of cause a problem for you. And that kind of stuff I can find. But, you know, one of the things a lot of women ask me is, will it ever get better? You know, have I gone too far? And we have a lot of our clients say, you know, I can't get that applicator in. Just like you said with a tampon, I can't get that in. You know, I've got a new partner, I've a new husband, boyfriend, girlfriend, whatever it is, and I want to be able to have in the vagina something happening in my vagina, and I can't. I just can't get it in. And even your applicator requires a bit of work. How do we help women in that sort of stuff and develop up a healthy, what we call it the radical or healthy vag? How do we get a healthy vag going?
Yes, yes. I wish people could be a little fly on my wall and see the progress that can go on. So to me, that seems like a no-brainer. You know, I see people get better all day, every day. This is, and that's what I think I want to express to women. This is an easy fix as soon as I explain it and start working with you. So we work internally, as you were saying, the direction and the lead. There's a lot of visualization that can happen. There's a lot that we talk about positioning, different positioning for intercourse. Where do we begin? Where do we find a pain-free position for the applicator, for the tampon, for intercourse? Start there, but educating women. Also, we're always protective. So knowing that as soon as I teach someone the difference, to feel the difference, any of us sitting here right now, can we tell, okay, when I'm tight, when I'm completely relaxed? Most of us know. And so that's an important thing to know about my body. Am I clenching and tightening, or am I relaxing? And as soon as I do that, I can start to make some progress. The other thing is, as I teach people digitally and give them feedback of, no, you're clenching, okay, here you're relaxing, there are also things called dilators, and women can then use that at home and continue that progress outside of the clinic, and we start with as small as we need. We never create pain in pelvic PT. That is not going to eliminate pain if I bring you into pain. We're always flying under the radar, of okay, that's comfortable, to retrain the nervous system, the tissues, the body, and break it down. Where are we running into problems? So dilators can be used independently at home, and you're instructed by a PT. As far as we were speaking about the Kegel, somebody instructing you, or you learning on the internet, the same goes on with the dilators. I really can encourage women, please get help, even if it's just one time, to get on the right path of that dilator. It is not, I'm shoving this in there. That's very harmful for our tissues, and I won't get the response that I want. I have to learn to work with the dilator, relax, stretch. And the proper, so with our internal exam, we're using lubricant to help decrease that friction. Picture a postpartum mom that we're getting started back in order to get her up and running again, physically running again. It all starts with getting the tissues healed. Maybe there's scar tissue from episiotomy or tear, or a C-section scar. Get the scar moving, get everything functioning with my diaphragm and my abdominals again, and then work the progress from there.
I know I'm going to ask a really personal question because you mentioned it. You mentioned about running, and I am reclaiming some exercise because I spend all day now in the house, and a lot of it sitting on my backside doing not much. And one of the exercises I do is I cycle, and even on the recumbent cycle, on any cycle, I find I get irritated. And I just wondered whether you have any tips, and I know that's an area you're interested in, is in people who do some exercise, who like to do some exercise, who want to keep their perineum well. I mean, I've got those chamois trousers, shorts, they don't really work, but I'm just wondering if you've got some tips for some of us who just, don't want to walk anymore, need to do some exercise, think about cycling even in the home. What can we do?
Yep. I think so I'm a triathlete, and so I will participate in a good number of activities. And I think what we are used to doing is slapping on some external friction reducer. There's numerous products out there. We do it just when we hop on the bike with our shorts, our padded shorts. But if we think about anything else in the body, I don't think I would moisturize and try to reduce friction. I would daily try to keep the moisture in those tissues so that friction and rub isn't going to be so great. Obviously, we get into a whole bunch of things too about seats and different things, but we start by taking care of our body and making sure that friction is reduced. And it doesn't have to just be women menopausal my age running into this. Nursing, when you are nursing, you're in almost a menopausal state, a decrease in estrogen. Estrogen really helps our tissues to be elastic and fluffy and absorb some of that. So nursing, postpartum, just getting that perineum back after any kind of trauma is so important.
Yeah, well, that's really good advice, because I was just thinking, I've used some of those silicone products and they just were sticky, and I don't know, I felt some of them made it worse, but maybe I just, have to find the right kind of products to keep on doing it, to keep the exercise running. Now, we've probably got a lot of mums listening out there, and what kind of messages should they say to their daughters and as their daughters are growing up and having their own children? What kind of messages can we give to them, not only about moisturizing, but about care, like what other care messages, what they should do about thinking and breathing? If you were going to give some messages to some of our listeners and viewers, what would you be saying to them about the continuum of care of the perineal area?
Oh, yeah. I think that is the key, is we have to start right from the get-go. I have all boys, but if I had girls, I would definitely start at the beginning. I know it's an uncomfortable conversation, but I know in most of the other countries, pelvic PT is a very known entity. Women have heard it. They go immediately. It's standard of care. Here in the US, it has not gotten to that point yet. So what my hope would be is that every mom realizes that the second your daughter can't use tampons, there's a pelvic floor dysfunction, and we catch it early and let her know there's nothing wrong with you. We just have to help you out here a little bit, depending on what your individual situation is. Then that girl knows that I have somebody in my corner with all the changes that are going to go on throughout a woman's lifespan, with hormonal changes, with intercourse. There is no reason that women should be suffering through painful intercourse. That is not normal, and we want to stop that. We also want to explain to women that social media is giving us one message that is so inaccurate. We are not designed exactly like men and follow in the footsteps of men. We are very individual as women. So I would want to empower the young women to know what is right, what is wrong, get help right away, not be embarrassed, and speak of it. And then continue that on with the changes of pregnancy, the dramatic pregnancy changes. And very often women are given the answer, well, you're pregnant. But there's a lot that we can do to alleviate some of that. And then the biggest turning point, I feel, as a pelvic PT, in a woman's life is after that pregnancy. We have changed a lot of anatomy. There has been a trauma, even though we don't like to term it a trauma, but it is basically that, with some tearing, some damage of our tissues. And we have to get on it right away with help. We would never return somebody to a sporting field with no care after a trauma, or, hand them, one little, do 20 squats and you're good to go. So we need, right at that point, to restore the body, because that's the beginning of the downfall of the female core system, really. And at a crucial part where we're caring for others and not caring for ourselves. And so we need to care for others. And I know every woman who has delivered vaginally has that fear of the first intercourse, nervousness of it's going to hurt. And if you have been checked out properly postpartum, that is eliminated. We have worked your tissues. You understand your tissues. We've set you up for success to move on, taught you about the care for the vulvar area.
Yeah, that's really important. One of the other little tests that I do sometimes is, when can women cross their legs again? Mm-hmm. When do they move from having their legs apart, and when can they cross their legs again? When do they feel comfortable with what's happening around that area to be able to cross their legs? It's another message that I always think is an important one. Theresa, it's been fabulous talking with you. It's been just great. I mean, we do this quite often, and I enjoy it, and hopefully we'll do it again soon. But I want to leave some time for our audience to maybe send some questions through, maybe if we can answer them. If not, perhaps they can go on the website. And I'm going to hand it over to Jerry to close it over and see how we can keep on helping women, give some information about who you are and what we are and what we're doing, so that women who are interested in this area, who want to participate, and we're looking for groups of women who want to carry the message out as well. I mean, there's so few of us now that are talking about this, so we're looking for women who want to carry this message out with us as well. I feel like I'm doing what I did a few years ago when I wrote my menopause books and my obesity books. I feel like I'm doing the same thing again. Let's get all of us working together to try to improve this area. So I'm going to thank you very much, and stay online. We're going to have some questions, but I want to hand it over to Jerry DiPiano, the CEO of FemPharma, to close it around and tell us a little bit about what we're doing at FemPharma to help women.
Oh, absolutely. So we didn't just land in women's health a couple of years ago, which is really the expertise of the company goes back for 2 decades. When we started as a research and development organization, that organization still exists, and we're developing products for endometriosis and overactive bladder and pain associated with fibrocystic breast condition. When we recognized that women wanted non-hormonal non-prescription, more natural alternatives. We found and listened to them. Surprisingly, we actually paid attention to what women were saying. And we took that information and we used our technology and know-how and understanding of women and women's health, and we developed non-prescription products in a sister company, which is totally separate and distinct. It's a consumer products company. And we're focused on more natural ways in which to address the continuum of care. We talked about a solutions-based approach that includes a combination of education of resources and products, starting with the perineal area and products that actually work, that are actually not leaky, drippy, or messy, but meet your needs. And that means that you have to be willing to use them every single day and not feel compromised. Let's face it, I didn't grow up thinking that when I reached a certain age and when I had to do my peritoneal or perineal care, that I had to use a diaper or a pad. Sorry, but even if that diaper or pad is beautiful, comes with flowers, it's not something I'm going to use. So when we developed the Satisfem, the Satisfet products, we designed them so that you could apply them every single day, multiple times per day, which is actually the best way in which to approach moisturization of your vulva and vagina without having to worry about a pad, without having to find it in your beautiful lingerie. If you want to feel good, you have to be willing to use a product every single day, but you shouldn't have to compromise your quality of life to do that. And that's exactly what the Satisfem and Satisfet products are doing. We're giving you that option. We also provide educational resources. Obviously, this webinar with Theresa Feola, an expert in pelvic PT, and with Dr. Deborah Saltman reflects our commitment to women and women's health care. We are a mission-driven organization that has been focused and committed to women and women's health care for 2 decades. And we will continue to explore new opportunities for you. Please reach out to us at FemPharma on our website, or use our 800 number, 1-833-FEMPHARM, and that's right on the screen here. We'll be happy to answer your questions. If you have product suggestions, we're always looking for opportunities to provide you with what you need for any age, from menarche all the way through menopause. I want to thank Theresa Feola for a fabulous presentation. If you'd like to reach out to Theresa, her information is here. If you happen to be in the Pennsylvania area, she is available for personal visits. If you happen to be in an area outside of Pennsylvania, she will do telehealth visits with you. Here's her information, and you can find that on thepelvicroom.com. But fabulous job, Theresa and Deb. Just wonderful to be able to impart knowledge to our viewers. And stay tuned for more. We intend to continue our webinar series. So thanks, everyone. And if there are some questions, I think we have some questions in the chat. So from Carrie, I don't know if my participants can see the question.
So Carol is asking, I am 78, still sexually active, and work out with a trainer for exercises for lower back problems, including stenosis in C7. I had pelvic floor therapy 2 years ago, and it has worked until this July when I had an injection for lower back problems. Now I have a problem with retaining urine if I bend forward. If I can maintain an upright position, I'm fine. Question, should I see my gyne or the neurosurgeon that gave injection, or someone else?
Well, first, I'm going to hand it over to Theresa because I'm sure she's got a lot of advice, and probably offline, Carol, but it's nice of you to tell us a couple of things. First, it's nice of you to tell us you're 78 and you're very healthy. Congratulations, that's amazing, and that's really, really good in our times, and we want to keep you healthy to 120, as they say. So we want to keep you healthy. The second thing is, obviously, you're very motivated and you had success for 2 years. And that is really important. Once you've had a success, you can have another success. That's what I say to people. All you need is the first little success. And even most of our life is a biorhythms of things working and not working. So things change throughout our biorhythms. And sometimes we have success for longer and shorter. I'm really pleased that you had 2 years of success. I'm not sure, because I'm neither a neurosurgeon or a orthopedic surgeon or a genitourinary surgeon, about whether it's directly related to the treatment you had. But I'm sure there's some things that just to start it, Theresa can tell you to start these things, start the ball rolling to help you again.
Mm-hmm. I would look at the timing of when that started. We're a canister. It's a pressure system. So as you say, when I'm bending forward, there's where I have the problem. I'm just curious, something has changed. Has your postural alignment changed with that back pain? Did you get weak in the hips, in the pelvic floor? Did you go into spasm? You know, without hearing any more details, it's difficult to say, but I agree. You can definitely restore this again. It is worth a shot to have a call into the doctors first, or see the doctors and just rule that out. And then by all means, in most states, physical therapists have direct access, it's called. We're able to see you without a physician's prescription for 30 days. So you could touch base with your therapist. Very often too, I will know if somebody has some red flags that comes into me, and I want them to go back and see their surgeon and see their doctor, and that it's not a PT first situation. But it's hard to say. Something has changed in the posture, the strength, the mobility of the muscles to start this process, but you'll get it fixed.
And also probably if you are having some leakage and that sort of stuff, now's a good time for protection, to moisturize, to make sure that the outer surfaces don't get excoriated and burnt and painful at this time as well.
Do we have any other questions from our audience?
No.
Well, that's very, very good, because we are about to let you go off. We've kept you for long enough here on this session. We hope you've enjoyed it. And if you have questions afterwards, you know how to contact us. The numbers came up. Please do feel free to contact us if you've got questions about Fem Pharma, or if you can get the wonderful Theresa. I've learned so much just working with you, Theresa. It's just been amazing. And the wonderful Theresa to help you sort out your problems and move forward and getting good perineal and pelvic health. Please contact us. Thanks to everyone. Thanks, Jerry. Thanks, Theresa.
Thank you, everyone.
Thank
Closing
you.
the chat. Okay, bye-bye. Thank you.
Bye.
No.
Bye-bye.